Yes, you can.
Am I audible, madam? Can you please confirm?
Yes, sir, you are.
Dear friends, good afternoon. We apologize for this 1 minute of little disturbance. So I welcome you all to the second session of the CBME workshop, which we are online national workshop series. We have had a very successful session last week where we touched upon and covered two very important topics. Number one was how to make your lecture interactive. Number two was introducing the concept of flipped classroom and how to apply it in your day-to-day teaching learning activities. So these two activities were there and very successful, and we hope that all of you will try and see how many of these aspects you can apply in your day-to-day practices. Today we have come back for another two very interesting and very relevant sessions. Number one is going to be the art and craft of preparing long answer questions and short answer questions, while the second one is going to be on preparing of multiple choice questions. So we have esteemed speakers who will be covering both these topics, and we hope that you will surely be very benefited. So with that, I'll just hand over the proceedings to Dr. Dinesh Badial, the chairperson of this workshop, to.
Thank you, Dr. Sushil. As we have gathered for the second component in this series 3, we welcome you all. As you know that you are already experienced the CBME in the UG medical education for the last 3 years, and now you have a revised PG curriculum in the CBME in the pharmacology, which is to be implemented now mandatorily as per the letter from the regulator. So we hope that these series, as we go for the second sessions, are going to be helpful you for all the CBME related activities which you are using in your institutions. Thank you so much.
May I now call upon Dr. Padmocha Kumar, President of our association, to say a few words.
Yes, good afternoon, everyone. Nice to again meet all of you. We have been, I should say, we are really overwhelmed with the response that we have for NAPTICON. So many registrations are still going on, and due to multiple requests, we have extended the early bird to the 20th. So, but further extensions are not possible. Please see that you register before the 20th of August. Also, I would want to just say one word that this conference is an excellent opportunity for postgraduates to present both poster and paper. Paper presentation, you won't get opportunity to present so easily anywhere else. Also, it is compulsory, it is mandatory by NMC to present one paper and one poster, and then also have one publication before you write your university exams. So I request all the postgraduates to make the most of it. Thank you.
Dr. Kamal, can you please release the NAPTICON video, please?
Can somebody allow me to share my screen? Please allow me to share my screen.
You're the co-host,
You're a co-host, sir. You can share your screen.
Is it visible now?
Yes, sir. Yes. Share your screen, sir. We can see the desktop.
Okay. Thank you. Thank you very much.
Yeah, may I call upon Dr. Padmacha Uday Kumar, our president, to please also release the latest issue of our newsletter, RX Factor. Dr. Kamal, please, could you please show the RX Factor on the screen? And I request Dr. Padmacha Uday Kumar, please do the honors. Friends, as you all know, our association is bringing out a newsletter called RX Factor every 3 monthly. We've already taken out. Yeah, Dr. Kamal, please.
Yes,
Can we?
Kamal, sir.
Yes, madam. May I request Dr. Padmacha Uday Kumar to please do the honors? Madam, you are mute. You are muted. Please unmute yourself. Can somebody unmute, madam, please?
Yeah. Now, am I audible?
Yes,
Yeah,
ma'am.
yeah.
Yes.
Yes, ma'am, you are.
Okay. So the fourth edition of RX Factor is released. I'm very happy to, in fact, do the. It's my privilege to do this honor. I congratulate wholeheartedly all of the entire team, starting from Dr. Sushil Sharma, Dr. Jayalalita, all of them who have worked hard for this RX Factor. More about it will be told to you by Dr. Sushil Sharma.
Thank you, madam. Thank you very much. So, friends, as you know, RX Factor is one of a kind initiative that is taken up by our association, and we are trying to encompass a wide range of topics, right from medical education to pharmacovigilance to research to ethics and regulations to current affairs and to cool corner, where we have got puzzles and scrambled words and cartoons. So even in this particular issue, we have got very, very interesting articles on, the problems with the adaconumab or the problems with the dostarlimab approvals. There's a medical education corner. There's a research corner on how to actually help the progression of research in the COVID aftermath. And current guidelines on vitiligo are also there. We have got a drug calendar, very, very interesting calendar where the every month approval of drugs in 2022 have been covered. And also we have got, like I said, unscrambled, very cool corner where the postgraduates can, we have got on Apticon, more information on Apticon is here. And at the end, we have got, very, very interesting puzzles and cartoons and other things. So I request all of you to please go through it. And yeah, this is again an extract of all the important discussions that happened in the NMDP workshop, NMDP WhatsApp group that is also here. So this will be shared with all of you. We are only taking out an e-copy of this, and I request all of you to please go through it. And I also thank wholeheartedly all the contributors of this RX Factor current edition. Thank you very much. So I think we can proceed from here. Yeah. So with that, let's focus on our today's business. And we have got, like I said, two very, very important topics that will be covered. And we have got two esteemed moderators who will be introducing the speakers. And it is my privilege to introduce both the moderators. So this is last week's. Let's have the new one. So we've got it is my privilege to introduce the first moderator. In fact, madam does not need any introduction. Dr. Nirmala Rege. She's the professor of Department of Pharmacology at ELMC ERA University. And we all know her as a Professor Emeritus of Pharmacology at St. GS Medical College. And she has got a long list of achievements, long list of awards, including PhD, DNB. She's a Famer Fellow from Philadelphia. She is a executive member of the Academy of Health Professional Educators. She is running a very, very hugely successful ICMR online prescribing skills modules. This is a very good module, and we should encourage our undergraduates and interns to be a part of it. She's an expert group member of the UG Medical Education Board of the NMC. She has been principal investigator of so many projects, right from CSIR, DST, DBT, etc. She is the faculty for GSMC FEMA Regional Institute, and she has been my teacher when I did my ACME from GSMC Institute. She was there and one of the resource persons there, and she has written a hugely successful book on the art of teaching medical students. This was one of the first books which I referred when I got interested in medical education. So thank you very much, ma'am, for giving us the honor and being a part of this workshop. Can I have the next moderator, please?
Thank you, Dr. Shan.
Yeah, next we have Dr. Arul Amutha Elizabeth. Madam is a professor and HOD of Pharmacology, Sri Balaji Medical College, Chennai, and has got a very wide teaching experience of more than 20 years. And she's guided more than 30 PG students and PhD students. Along with a renowned pharmacologist, she's also done a diploma in family medicine. And her interest in medical education has led to her to complete the ACME course. And she's got more than 45 research publications in various journals. So these are our two esteemed moderators who will be steering the two sessions today. With that, may I now request Dr. Nirmala Rege, madam, to please come up and introduce our first speaker.
Thank you, Dr. Sharma. And at the outset, I thank organizers for this webinar series because that enriches us with the concepts and principles on a particular topic, and also provides us tool to apply whatever the knowledge is gained in our daily teaching practices. And friends, all of you are aware that we have to use question papers to test the cognitive ability of our students. And with this CBME curriculum, we have to now test their competency at different levels, the level of knows how, and at times further shows how also. So not just the junior most paper setter, but also a senior faculty like me sometimes become very anxious while drawing up such question papers. And we wonder whether whatever the questions we are drawing, whether they are appropriately framed, whether they are too difficult or too easy, or they are conveying the same meaning as what we want to test, or they are conveying something differently. And whether I'm wasting the opportunity which I've got through for setting up a question paper if I'm not using it properly. And therefore, we are always look forward for the techniques and tips that will help us in framing long and short answer question, maybe in pharmacology, clinical pharmacology, and therapeutics. And that is exactly what Dr. Margret Shanthi is going to do in next 22 minutes. And she is a professor at Christian Medical College, Vellore. She is a convener also and head of the NMC Nodal Center for National Faculty Development at same institute. And she is very much interested in medical education work and has various innovative studies and implemented new ideas for the UG students. And she has completed the course, advanced course in medical education, and therefore this responsibility has been bestowed upon her as a convener. And she's therefore looking after all these revised basic course workshop, even the advanced course in medical education, CISP and faculty development program. And she is a member of curriculum committee. Not only that, she is a representative in-house. She has got that award. And she, in 2018, she was awarded as a Best Teacher Award by her institute. So now let's hear from her on long and short answer questions. And I request audience that please put up whatever the questions come to your mind in the chat box. So it will be easier for us to take them up during our discussion. So now it is almost 15:24. So next 20 minutes, let's hear you, madam. Dr. Shanthi.
Good afternoon. You can hear me, ma'am? Good afternoon. You can hear me, Dr. Nirmala, ma'am?
Yes, madam, we can hear you.
Yes,
Please
we
go
can
ahead.
hear you, but
Yeah.
just come little closer to the.
You can hear me?
Yeah.
Yeah. Thank you so much for introducing me. And it's a great honor and a privilege for me to be talk on the CBME 3 series. And I try to do it in a very simple way, how to set up a question paper, long and the short answers. My session for today is Art and Crafts, long answer questions and short answer questions. So my objectives of my class, my sessions will be the tools that are going to be useful for assessing the knowledge and also reviewing the guidelines to how to construct a good long answer and short answer questions and merits and demerits, and how to frame and improving a long answer questions and short answer questions, and how you can motivate to make a big change in the practice of a paper setting. So what are the tools that we are going to assess the knowledge? It is nothing new for a teachers, especially in a medical curriculum, that setting up the long answer question and short answer question, because the students are already being trained, or the teachers are being trained in setting up even from the kindergarten to college level or a school level. The student, when we set the question papers, and most of the time in a high stake examinations, maybe 100 years back, it's a long answer which has been used for as a promotions and assess the student knowledge, like a composition they used to give it. But then there is a principle behind how we can set up the long answer and the short answer question. That's what we are going to see in this sessions. So whenever we set a question paper, it will be always from the nose level, from the recall. From the recall, we go to the next level, the higher cognitive, that is the applications level, knows how. So we don't go much onto the shows how and does, it's more on to the performance and the competence. So we don't go to that. But an essay question, most of the times we do it as the recall type. From the recall, we go little higher order, that is knows how. So in the alignment is very important. Whenever we set the question paper, we should remember that alignment, and alignment should be always aligned with the learning objective, that is a specific learning objectives and the teaching learning methods and the assessment. The learning objectives must be very clear to this teacher as well as for the student, and what the student should know, and in what way they can able to do it later. And learning activities, what we are teaching in the classroom, how the students should learn, and we have to align with that assessment task. It's said in a curriculum, a medical education curriculum, if it is not going to be aligned with the learning objectives or teaching learning methods, and if there is no assessment, student will never learn. The assessment which drives the student for learning. So what is the definitions of a long answer question? A long answer question is an examination of the question that requires an answer in a sentence, or it can be in a paragraph, or it will be in a composition format. So what are the guidelines? There are guidelines out there in the long answer question. We should always remember the guidelines. It is most important, commonly used format for assessing knowledge, cognitive, and the knowledge, breadth of the knowledge and the depth of the knowledge. And we expect students to write a long answers for the broad topic that they have a freedom to explore various facts of the topic. And also it can be assessed how much breadth of the student knowledge and the depth of the knowledge of understanding, the ability to organize the thoughts and critically analyze information. It is a riddle, actually. If the student can know the prior knowledge of the question or how they can answer, and they can connect, they can connect it with a concept and link it, and they can have a conclusions, and they can come out with a good answers. But at the same time, actually, it's an invaluable skill. Not everybody can do that skill. But if the student acquire this invaluable skill of writing the essay question, then they will be very much doing good in academic. They may always get a grade of A or a B in the class, because they know how to write, especially in essay question. And because they know the knowledge, they have some kind of a concept. From that concept, they keep connecting it. So coming back, how the short answer questions have been done. The short answer questions are assessed that can be answered only with a few words or a phrases. Describe me in a few words. So the guidelines of the short answer question, it should be always specific. We must not ask broad, like how it's an essay questions. We must not give student for guessing. We should enable the student to construct the responses to the specific what we are going to ask. And we will not allow the student to guess or recognize. Whereas a long answer question, they can write anything, just like a composition. And they can also, sometimes it will not be relevant to what we are asking, what we wanted to assess. But in a short answer question, it's not like that. The short answer question, the student should know the specific to that answer. And there are merits and demerits are there. What is merits of the long and the short answer question? It can be marked by different assessors. You can test the knowledge of reasoning and organizing the ideas in an individual opinion, and it's easy to set. If it's an essay question, it's very, very easy to set. And you allow the candidates to express themselves. So these are the merits. And how they can assess, different assessors can make your key answers should be made. If the key answers are perfect, that the learning objectives and the outcomes are very clear, then you can make a key answers. Even how many of our assessors are going to correct the paper, it will be marked almost the same. So the marking different assessors is easy, unless then we have the learning objectives are very clear for that particular topic or a particular question that we are going to set. But at the same time, there are demerits are there. Lack of reliability in scoring and subjective assessment in scoring, especially in essay question. Bias happens, how the allo and anti-allo affect, even sometimes names and handwriting can always divert a teacher, especially. But in a university questions, all the question papers are in a code or a codings are there. But in a day-to-day classes and in a department wise, there is no codes are given. And we know the students' names. Sometimes the student write very good answers in the beginning, and then they may have so many the third question wouldn't have been appropriate, but then the halo effect is still there. And the time consuming. Whenever we set the question paper, you should remember the time limit. Earlier in 2006 and 7, I think in MGR University, there was a question papers like that. I think for the past 3 years, they were doing that. There is a time limit they give and the pages, how much you write for the essay question. They will tell 20 minutes for an essay question, and you must write 16 pages. May not be pages are being encouraged, but then the time when you give it, it should be encouraged. I think is taken it out, but then the time is very important, because sometimes when we ask very broad way the essay question without a specific thing, we give lot of where the students can divert, and that should not be happen. It should be very specific. So the validity sometimes can be low if not properly framed. So as a teacher, we are always use the Bloom's taxonomy or a Miller's pyramid to setting up the question papers. But then if it is not planned well, if it is not framed well, sometimes it will have a great impact, a negative impact on students. So the question paper, when we frame, it should frame whom we are assessing, what are we assessing, what are the domains that we are going to assess, and whether the assessment is summative or a formative. It should be clearly which, whether it's an undergraduate or a postgraduate or alike. So it should be clearly been known to the teacher who's setting up the question paper. So this happens most of the times when we see in the university question papers, essay question does not have any scope of the expected answers. And then the candidate may interpret what they think is important. But this, for example, is just an illustrations, but there is no scope. An essay question on an elephant, the candidate will be thinking, I have to write on trunk many pages and then some things about tail and somewhere in the year. But the examiners will be thinking, if the students explain much about the year, he get a good score. So the paper who set the question paper, paper setter have a different opinion, and the student have a different opinion, and the examiners have a different opinion. So this what disconnect sometimes happen in a question paper when we sit. So how are we going to prevent improving the quality of the theory questions and the long and a short answer questions? How are they structured? What do they test is very important for the teachers before they set up. And it is clear to the student what the examiner is asking. So it should be very specific. We should not give a lot of loopholes to the student to have many ideas. In one question, so many things cannot be asked because the students don't know what they have to answer. And if any number of experts answer, it will be the answer should be the same way. So the key answer is important. So overcoming the disadvantages of a long answer question, a short answer question, you must have a detailed blueprinting. So to prevent sampling and bias sampling, and should always test a student in a higher cognitive level. MCQs can go into the recall type, but when it is come to an essay question or a short answer or a long answer, it should be little bit higher cognitions should be there, that is knows applications level. And the answer key, it should be uniform. You can discuss and agreed upon weightage from must know areas. In every topic, every subject have must know, good to know, and nice to know. But our weightage should be always, the student should be very clear. These are the topic, the weight carries more weightage. So the blueprint should be shared sometimes with the student, and not only to the student, may not be we share the question papers, but then the weightage where we give to the topic, it not only shared to the institution level, even to the paper setter, to the university level. We should share our learning objectives and our outcomes. And the person who's setting up the question paper are very clear. So these are the weightage and these are the outcomes, and this is what we are going to assess. And then the one who corrects a paper is also be shared. So it's very important, any long or a short answers, we must have a blueprinting very clear to the student and to the teacher, the one who teach, the one who set the question paper, the one who corrects. The questions correction sometimes should be blind to the student identity and avoid distractions while grading. So the critique of the following long answer question, this is an activity as I put it. And like, for example, this is one of the question paper in a university, MJ University. Apparent mechanism of actions, adverse effects, indications, and toxicity, 10 marks. But the student here don't know whether the mechanism of action apparent, I should write 10 pages. Oh, that is a weightage of this question. Or the teacher, one who set the question paper, will be thinking the toxicity of apparent, the student should know how to manage a toxicity. But the student will be thinking mechanism and that is important, but the teacher will be thinking the toxicity. But one who correct the paper will be thinking, as long as the student knows the adverse effects is more than enough in apparent. So, but then it's a confusion, there's 10 marks where it is. So now it's a time to change. How are we going to reframe these questions again? So we can do it like this, which is more simple, very narrowing. We should not be broad in setting up the question paper where we give lot of ideas, information to a student to write as what they want it. So to make them not to wander much, to become narrow the question that we ask so that they can write to the point, you can just reframe it like this. Classify the types of apparents. That means it carries only 1 marks in the weightage, and write a note on apparent elaborating its mechanism of action is 2 marks, and advantages, uses, and contraindications 2 marks, 1 mark. So the divisions of the marks should be very clear. The breakdown of the marks should be very clear to the student so that they can stick on to the point where they wanted to answer. So it narrowed down. So if you're going to ask broad, they will write so much, but then the one who correct, the one who said there is a lot of disconnections happens. To prevent it, be more specific what you wanted and what is your outcome. So this is one of the MGI University question paper. I just put it. Classify the this is a recent paper of 2018 August. Classify antiemetic. Actually, it's so much there to write. There, just write, ask for 10 marks. How will you manage? How can you ask, how will you manage motion sickness? How will you manage morning sickness? The drug-induced post-operative nausea and vomiting, anti-cancer chemotherapy induced. The student, when they look at this question paper, they will be thinking, as long as I write the classification of antiemetic is more than enough. Maybe it is so much there to write about classification of antiemetic. But management is something like more onto the applications, more onto the into the next level, from nose out to show. So how can you ask the student for the management in this? Management ask about the history, the previous history, the cure, the prevalence. So many things there in the management. But student, how they will write in motion sickness? So now you can reframe this question. Maybe student will write all about antiemetic drugs and he will be happy at the end. And he will write motion sickness, anything, maybe pathology or management, anything he can go. There is no specific what the student has to write. But now the time to reframe it. How can you reframe it? You can just ask, classify antiemetic drugs carries in the highest weightage of 6 marks. If the student knows it is good. Next, you can write, you want to know the motion sickness. You can just tell them, mention, that is an understanding, knows how. Mention 2 drugs used in motion sickness, which carries 1 marks. If they write 1, it gets 0.5. If they write 2, they get 1. And name 2 drugs that are used in morning sickness. List 2 drugs used in post-operative nausea and vomiting. You cannot ask the question, the last question, you can see the anti-cancer chemotherapy induced vomiting. If you see, most of the anti-cancers will cause vomiting, not one drug. There are so many drugs. There are more than 50, 60 drugs are there in the anti-cancer. All the drugs cause vomiting. So you should be very specific when we are asking, how does an anti-cancer drug cause nausea and vomiting? Maybe that's more cognitive, more applications as the student can come to a conclusion. What are the cancer drugs? What's the mechanism behind that the patient gets when they take a cancer chemotherapy drugs induce vomiting? So you can have a breakdown marks. So student knows my weightage is, if I write well, I get 6 marks. If I write all other things, the student knows the weightage of the marks. So you have to modify your question papers like this. The next one, the same long answer questions. A patient, you can do it with the scenarios in a level of cognitive and applications. So you can do that. And then a patient is brought to the emergency medicines department with a symptom of suggestive of organophosphorus compound poisoning. So it's already, the clue has been given. So it is nothing that we need not have to, the student has, the diagnosis is not understandable very clearly in the scenarios. This patient is an organophosphorus poisoning. Sometimes that can be blinded also. We can just tell the patient came with the muscarinic symptoms, so the meiosis and having urinations and salivations and bradycardia and hypotensions. All these clinical symptoms you can ask, and then you can just ask what is an antidote. But here is very clearly given organophosphorus. But you can see the next question has been constructed. What is an antidote for the above poisoning? then the next, we don't know the weightage. What is a weightage for the poisoning? Whether antidote, the student just write atropine. So just writing atropine, how much marks is going to get it? And write in detail on receptor antagonism with the suitable diagrams. What receptor antagonism you wanted the student to write? Whether it's a muscarinic or a nicotinic, only 2 receptors are there. Which receptor the student will be writing? Whether there are so many muscarinic M1, M2, so many receptors are there. It is not very specifically asked. But when you're asking about the patient of organophosphorus poisoning, suddenly the third question is asked, right, about myasthenia gravis, which has not been related to the case scenarios. So when you wanted to put up a case scenarios, you should stick on to the case scenarios, and then you should have a lead questions. When the case scenario is something and your lead question is something, it's just, there is no need to put up the case scenarios. If you wanted the applications level, the scenarios should have a same the stem, and then the lead question should be appropriate to the question which is above. So here it is, all are different. So now to modify or reframe this question, you can do it like this. Interpret the treatment of organophosphorus poisoning. That means you get 3 marks. That means interpret. The student have to write not an antidote of atropine, because we don't know. We have to give the marks because the student just asks what is an antidote. Easily they can do it. But when you ask the student to interpret, it takes time to explain about that, and then describe the mechanism of action of muscarinic receptors. And then you can paraphrase the cholinergic reactivators. What are the cholinergic reactivators are being used? So they will write about the cholinergic reactivators like ovidoxim and pyridoxins. Now come back to the short answer questions critics. So justify beta blockers used in hypertension. How can a student justify beta blockers? There are so many beta blockers are there. But now the time to change the way that we ask the questions. You can have a scenarios like this: a 50-year-old man present with an hypertension, and he has been taking metoprolol at a maximum dosage. He's on the other medication for blood pressure elevated, and his examination otherwise unremarkable. You decide thiazides, diuretics. So you can reframe the questions with the scenarios properly, and then you can just narrow down that beta blockers. Right, explain the mechanism of action of metoprolol so that the students have been narrowed down. They should write about metoprolol, identify the mechanism of thiazides, diuretics, and list 2 electrolytes which carries 1 marks. And if they write 1, they get 0.5. They write 2, they get 2 marks, 1 marks. So this is a way mark division should be very clear. Even in the short answer should be very specific. If you just justify, they will write everything. So it's very important, and we cannot assess the student knowledge. The next one is question number 2 activity. This is a university questions. Write short notes on biotransformations. Actually, biotransformation is so much. Even in book, you can see it, so many pages of biotransformations. The student don't know how can he write 5 marks, what they have to write it. So whether phase 1 or phase 2. So you reframe the questions. Either you can write brief state phase 2 biotransformation reactions, you can give 3 marks, and with us 2 suitable examples you give for 2 marks. So it will be 5 marks question. Or enlist a phase 1 and phase 2 reactions with 1 suitable examples for each. So you can reframe it so that you narrow down what you wanted to assess the student. The next one activity is drugs used in bronchial asthma, and write a different techniques. This is one of the university paper has been given, recent paper this is, and it is written that different techniques of administrations. How can you ask different techniques in a short answer questions or in a questions? We cannot ask different techniques. Maybe it's a performance or in the dust level, or you should narrow down it and ask a different, what are the different inhalers are used, or what are the inhaler drugs are being used. Techniques cannot be asked in the university exams, right? Different techniques of administration, that's also whether techniques for bronchial asthma or what techniques they are asking us. So it is not very clear to the student how they, so reframe it. So discuss the role of sympathomimetic in the management of bronchial asthma with 2 drugs used in the asthma, or you can ask, describe the role of inhaled steroids, bronchial is used in the bronchial asthma, and 2 drugs used in the bronchial asthma? What are the inhaled steroids? So you can just reframe the questions again to be more specific. Some of the questions cannot be in the nose level. It can be in the dust level. So you create a question in such a way it should be more specific to the student. This is one of the journal that I looked into it. It's very interesting, like the cognitive dimensions and the cognitive level and the actions required. You can see the remembering, that is a knowledge, that is a cognitive level will be very low. You can actions required, list, name, identify, shows, define, recognize, recall, state, etc. What is the mechanism of action of acetaminophen? Then next is understanding, comprehension, that is cognitive level is again low. Summarize, explain, interpret, describe. So describe the goal.
Madam, just 2 minutes more.
Okay, sure. So this is the next level. So you can always do it in the cognitive level low or the cognitive level high. So the disconnect happens when there is no alignment. So you must very careful the alignment of your objectives and the learning activities and the assessment is important. You can use a sample rubric scoring sheets. It's very important, especially for essay question. What are the points to be? You want the key points. If the student writes well, he gets full marks 3. If the student don't write, get good. They write fairly, get 1. If they don't write, it's 0. This is sample of the rubric scoring. To summarize this, long answer questions and short answer questions should be aligned with the specific learning objectives, the competency that we are going to assess, and construct and structure the questions and guidelines and plan the assessment. So I acknowledge Dr. Dr. Kamal and Dr. Sushil Sharma and my moderators, Dr. Nirmala and Dr. Arul Amutha.
Thank you, Dr. Margret. Very lucid presentation. Let's go to the questions directly. And there is one by Dr. Ranjit. He has put it in the chat that, Madam, in the example of structured LAQ of heparin, shall we also mention the number of therapeutic uses, adverse effects, and contraindication? This question, which was shown to us on heparin, yes. He's just asking you whether the number should be specified.
Yes, ma'am. It's very important. Number should be specified.
Yeah. And the second one is by Chitra Khanvelkar, and Dr. Sindhu seems to be in agreement with her comment. She is saying that in modified antiemetic, I think the question becomes just a group of 5 brief answer questions. Yes, it is just enumerate the drug or name the drug, then it becomes very simple that way. So will it be very too simplified LAQ, or it is?
That the question which I critique, that is a question of the university. If you want to modify that, because you are giving, because classification of antiemetics is so much there to write, ma'am, and you can give the weightage. If you don't want to give, then you can change the question. What are the pathophysiology of motion sickness, and name 2 drugs. You can modify that.
Or the mechanism of action, how these.
You can write that, and then I'm just putting up the in the university question paper. But in this question paper, how can you modify it? Yeah. Whether you wanted to give the weightage for more than emetics, and you wanted to give the weightage for more for motion sickness, morning sickness, and drug induced, you can change the question according to that.
And the third one, this is the last one we will take. Brunalini Kalikar, and she has mentioned, do we need to validate LAQ and SAQ? And if so, how to validate those?
Yeah, it is very, very important to validate, ma'am. You can validate in your peers, in your own department. You can just pass the question paper. You wanted to have a time frame, you can just pass it on. We can see how much time has been taken for that essay question that we frame, because validity is very important. The utility of the assessment, it plays an important role in when you're setting up the question papers. So you have to validate in your own department if how the answer question will be answered in the same way. So the key answers to be prepared. So in your own peers, in your own department, you can validate the question paper before you take it to the public.
I know there is one more by Ritesh, by how can we set a model answer for university exam? I think you can answer that on the WhatsApp group or in the chat box itself.
Yes.
We will have to stop now. And I just want to say one thing. You told us about knows and knows how level, but I think even shows how can be introduced in it. If there is a case scenario and if we ask them to write a prescription for that given case scenario, then automatically it is shows how. Or we ask them to select a P drug for a given condition, then it is that everything will come. That what you have shown us, that going to a higher level as up to evaluation will come over there, and then there is their own creation of mentioning it. But we have to give a proper condition and scenario for that, and time also.
Should be, once a scenario is very proper, you can go even to the dust level. Even you can put up the scenario, what will be the drugs being used for these conditions, like in prescriptions. You can do it, but then how we frame that question and who we are going to assess, whether it's an undergraduate or postgraduates, the framing the question is important,
Yes.
which level that you wanted them to go.
Yes, totally agree with you. Okay, so we will stop over here. Thank you so much, Dr. Margret, for this. And please answer them in the chat box, whatever they are answering. And I request all the participants, you can later on in the WhatsApp group also, you can go on posting the question. It will be there for this 1 month. Thank you.
Thank you, madam. Thank you very much. May I now request Dr. Elizabeth to please introduce our second speaker.
Sir, thank you. Am I audible?
Yes, madam, you are audible loud and clear. Please go
Okay.
ahead.
So before introducing, there's a saying that merely applying a particular tool is not enough. Rather, how well the tool has been designed makes all the difference. So designing a good assessment tool requires time and effort, and constructing a MCQ is an art. Actually, it is a laboriously acquired art, and ultimately designs the learning outcome. So for this, we are having with us privileged speaker, Dr. Puneet, and happy to introduce him. He is presently is the additional professor of pharmacology, AIMS Rege, and he has done his post-graduation PGI Chandigarh and DM clinical pharmacology also from the same institute. He has worked as medical advisor in the Ranbaxy laboratories, and to his credit, he is having 45 publications, including big chapters, and he is working in AIMS since 2013. I welcome you, sir, to give us an introduction how to construct a validated question. Thank you, sir. Welcome you. Sir?
Dr. Puneet, you can unmute yourself and please share your screen.
Puneet, sir?
Now I am able to do that. Thank you, sir. Thank you, ma'am, and thank you, Dr. Kamal and Dr. Sushil, for giving me this opportunity to present something which we have been doing at AIMS Rishikesh for last 4 or 5 years. So it is all about MCQs and how we frame and how we assess that. So I hope my screen is visible and
Yes, sir. It is visible.
so without wasting much of the time, and I would straight away go on to the it will be primarily the basics of MCQs. Then how are we going to design a multiple choice question, followed by how are we going to review a multiple choice question. Then one or a couple of slides about strengths and weaknesses of multiple choice question coming to the end. Finally, we are going to conclude the session. Now, when we start with the basics of MCQs, like the previous speaker, Dr. Margret, has already said that assessment drives learning. So how we assess actually makes the students, how it makes the student learn. Now, if we are assessing on the basis of short answer questions or long answer questions, they will read the text and they will prepare themselves for writing the text also. But when we are preparing, when we are assessing them only on the basis of multiple choice questions, so their way of reading and their way of learning changes. Now, how to improve on the questions for basically how to frame multiple choice questions so that student is able to understand the concept and grasp the and is able to answer what is expected in a particular situation. That is the topic which we are going to discuss today. Now, MCQs as a part of medical education were introduced in 1950s. And what exactly is is a multiple choice question? So MCQ is an objective question for which there is prior agreement on what constitutes the correct answer. So the agreement is already there. So we do not need to prepare a key like for short answer questions. We already know what is the answer and the key is prepared for a particular MCQ. We do not need to have a complete breakup of the answers which we expect. So we already know what is the exact answer for that. Now, for what are the types of multiple choice questions? The types of multiple choice question can be single best answer. Then there could be extended matching type of multiple choice question. Then there could be assertion and reasoning type of multiple choice question. So these are the three types which are commonly used. Most commonly used are the single best answer type and the assertion reasoning type. Extended matching type can also be introduced, and we are going to discuss briefly about how to frame such a question. Now, what actually constitutes a multiple choice question? So there has to be a stem, there has to be a leading question, there has to be some one answer, and there has to be some distractor. So these are the basically this is the anatomy of multiple choice question. So the stem, like we can always have a discussion on the basis of this question and this example. Now this example will be used across throughout the presentation today. So we can always, if we are able to grasp whatever it is, the question itself. So there is a case scenario, which is the stem. Then there is a leading question, which we expect from the students to answer. Then there is one particular answer, which is the correct answer. And there are few distractors, which can be 4 or which can be 3, depending on the pattern which we want to choose. So this is the anatomy of a multiple choice question. So all these items, all these the parts of MCQ need to be framed properly so that student is able to grasp what exactly he needs to answer. And from the answers and the distractor, the examiner is clear what we are expecting from the student. Now, before we actually go on to framing the multiple choice question, what are the requirements before designing a multiple choice question? The most important thing is the blueprinting. Now, what is the blueprinting that we have that most of us actually know? So it has to be planning of a test as per the learning objectives or the competencies which we want to assess. So without blueprinting, we cannot formulate a good multiple choice question or good question for that matter. Once we have the blueprinting, we need to select the theme. Whether it is hypertension, the theme could be an important concept, which is a common or a serious clinical problem. Now, since today's session is all about scenario-based multiple choice question, so we are going to discuss only in terms of the clinical relevance. We are not going to think about the recall information primarily. We are going to focus only on the clinical information which is relevant. Then third aspect is the situation or the scenario in which that important concept or the serious clinical or the common clinical problem needs to be discussed. So then first is the blueprinting, which will give us the learning objective. Second is the selection of the theme, which could be a common problem. Third is the context in which we want to ask the question for that particular theme, whether it is about the adverse drug reaction, whether it is about the efficacy of the or the drug-drug interaction that we will see in the next few slides. So these are the prerequisites for designing a multiple choice question. Now we start with framing of the question. How are we going to design a stem? Now the easiest way to design a stem is to recall or recollect a routine or a rare case scenario, which could be either hypertension or diabetes or tuberculosis or malaria, which is relevant for undergraduate medical student or maybe up to the postgraduate medical student. So we can always first is to recall or recollect a routine case scenario. Then we need to recall or recollect what are the therapeutic questions which we can which were encountered regarding either the choice of the drug or the doses or the interaction or the ADRs or the management of those particular ADRs or any therapeutic alternatives. So once we have these two things in our mind, we can easily start framing the multiple choice question. Now, what are the principles for designing a STEM? The first principle is the problem should be stated clearly and correctly as possible. That is very much understandable. Second is we need to avoid putting in irrelevant information with respect to the lead-in question. That is, lead-in question is what we actually expect from the students. Then we need to avoid using negative terms like all except or not. So we are going to discuss it in the next slide with the examples. So we need, or in case we want to use the exception, we want to know whether it is, where is the exception, we can highlight the negative term also. Fourth principle is we need to avoid testing recall information unless it is clinically relevant. So only clinically relevant recall information should be focused on the scenario-based questions. Now we look at the example of MCQ. Now the question is very simple. The route of administration in unconscious patients cannot be. Now this contains a negative term. It does not have any scenario. Although it is, we can call it as a multiple choice question and there is a correct answer. There are distractors which are similar in nature, but we, if we rated this MCQ, we may not call it as a good quality MCQ because it contains a negative sentence. It does not give any clinical relevance and it may not be appropriate in all the patients. So this is about designing a STEM. Now, one example for designing a STEM of the question is on describing a case. One way, this is one way. We are going to look at the other way of designing a scenario. Now, there is a patient of atrial fibrillation. We have a diagnosis who is on first-line anti-tubercular therapy. Here we have a medical history who has been prescribed tablet warfarin for preventing thrombosis. So this is one case. We have described the whole scenario in one particular line itself. Now, he has been taking about a male who presented with palpitations. There was no past medical history of any diabetes, IHD, hypertension, or heart failure. No history of smoking, no history of alcohol or illicit drug use. So we provide a lot of information about his medical condition. Then on examination, we give a lot of systemic findings. So basically in this situation, the way the same scenario is being discussed, we are providing a lot of unnecessary information with the same meaning. And ultimately what we want to test is the interaction potential of warfarin with anti-tubercular drugs, or it could be a drug-drug interaction, or it could be a drug-food interaction. So this is the competency, or this is the knowledge or the competency which we want to assess, but we have provided a lot of unnecessary information, irrelevant information in the second way of presenting the case. Now, what could be the possible lead-in questions? How can we design a particular lead-in question? Now, it is definitely on the basis of case history which has been provided in this STEM. It should carry clear directions for the students, what is expected, what the student is expected to know or to how to answer. There is no place for tricks in MCQ. Now, as far as tricks is concerned, in this case, the case history that we have described, there is no mention of tuberculosis. But there is a mention about, we have mentioned about the drugs. So this is, if the student misses one or the other drug, which is expected that if he is reading this long case history, he may miss one or two points or one or two words, which will ultimately change the answer. So there is no place for tricks in multiple choice questions, and terms like always, never, and only should be avoided in medicine. This is because that biology is not mathematics. So we need to avoid always, never, only, or the exclusive terms in any of these questions. The fifth principle of a good lead-in question is that ideal lead-in questions should be answerable without looking at the options. Now, this is one principle which is used for assessment of all the MCQs later on. So if the lead-in question is clear, we should be able to answer it even without looking at the options. So that is the ideal lead-in question. Now, in this case scenario, which has been discussed, a patient of atrial fibrillation on anti-tubercular drugs who has been prescribed warfarin, and he is taking green leafy vegetables. So he presents to OPD with complaint of swelling, bluish discoloration of feet. Now, which of the leading question could be in the form of a statement which of the following is the true statement about this patient. So we can always frame these answers or the distractors accordingly. The second way of lead-in question could be which of the following lab investigations will be highly valuable for optimizing therapy in this patient. It could be about the diagnostic test. Third lead-in question could be which of the following is the most important clinically relevant concern of treating physician in this case. Whether it could be, we can have a statement regarding the thrombosis, or we can have a efficacy of the meals. So if we replace it, the patient with a pregnant woman who has been given folic acid supplementation, so the difficulty level increases. The fourth possibility of a lead-in question is which of the following is the possible drug-drug interaction in this case, in this patient. So these are the 4 ways in which lead-in questions can be framed for this particular same case scenario. Now, what are the terms to avoid in these questions? Always, never, all, or none. Reason is because medicine is not mathematics, it is biology, and exclusive terms may or may not be true. Then the terms which can have a different interpretation, may, could, or can. Yes, everything is possible, so it is better to avoid use of such terms. Third is seldom, rarely, occasionally, or few. Basically, these are the terms which can be interpreted differently by the examinee, or even if like rarely. So it is open to interpretation. So it is better to avoid such terms in the question, in the lead-in questions. Then how to design the answers and the distractors. Like what we have discussed, ideal lead-in question, the answer should be clear from the lead-in question, even without going through the options. So answer should be clear from the lead-in question. The answers and the distractors should be the possible homogeneous options. So there should not be any difference either in the grammar, length, or complexity of distractors. They should be homogeneous. Then when one or more option has some element of truth or accuracy, it is better to go for the option of select the best answer rather than the correct answer. Because medicine, there could be many possibilities, so it is better to go for the best answer.
Have we lost Dr. Puneet?
Not audible.
He has unmuted, sir. He has unmuted. Puneet, sir?
Yeah.
I
think there was some connectivity related issue.
Yeah, sir. Yes. Proceed, sir.
Yeah, like in this case, we have discussed that which of the following is true statement about this patient. So these are we
cannot see your screen, Dr. Puneet.
Okay, just give me a minute, sir. Can you see the screen, sir, right now?
No, so far no.
Okay.
Maybe you can reshare your screen.
Just give me.
Share your screen, sir.
Yeah.
It is sharing, but not visible. Yes.
Yes, now we got it.
Okay. So these are the distractors. What we were talking about, the answers and distractors. So we should have a clear, the answer should be very much clear from the lead-in question. And distractors can be framed according to the level which we want to assess, whether it is undergraduate, postgraduate, the clinical situation. Then we move on to the next type of multiple choice question, that is the reasoning assertion type MCQ. Now in this reasoning assertion type MCQ, we have a assertion which is a statement or a fact which follows the case scenario. So in our practice, in practice of medicine, most of the things should start from a case scenario. and there is a statement or a fact, and the reason is the explanation for the assertion. So, like in this case, a patient of atrial fibrillation on first line ATT who has been given warfarin. Now, what could be the assertion? There is loss of efficacy of warfarin in this patient. The reason could be there is a pharmacokinetic drug-drug interaction in this patient. Then we have the options. Both assertion and reason are true, and R is the correct explanation. Both assertion and reason are true, but R is not the correct explanation. If A is true, but R is false, and A is false, but R is true. So these are the reasoning assertion type of questions which can be framed from the same case scenario. So, one case scenario can be used for multiple types of questions and for assessing the multiple competencies or the multiple levels of the knowledge of a student. Then comes the extended batching type of MCQ. Now, extended batching type of MCQs are organized into sets that one uses. So there is one list of options for all items in this set. So it begins with list of 4 to 6 options. It is followed by 2 or more patient-based items requiring examiner to indicate the clinical decision for each item. And the candidate is asked to match 1 or more options to each item. Now we will discuss this thing. The same case scenario, a patient of atrial fibrillation on ATT with warfarin, who has been on warfarin. Now, what are the options for this? What are the questions? Now we have 2 questions for this situation. Now, which is the best strategy in this patient? Whether the clinician should increase the dose of warfarin, or clinician should change the ATT, should give platelet concentrate, or no intervention is required. So these are the 4 options. Number of options can be more. I have just listed 4 options. It can be 5 or 6 options. The question is, which is the best strategy for this patient? So we can always choose the best strategy for this patient. And the second question, follow-up question can be which of the above is least likely to be beneficial in this patient, whether it is platelet concentrate or it could be no intervention which is required. So these are the extended matching type of questions where the case scenario remains the same, the number of options remains the same, and we have follow-up questions based on the same case scenario depending on what we want to assess. Now, once we have framed the MCQs, it is important to review the multiple choice questions. Now, it is something like how we write a manuscript. We read it, the first draft, and then we prepare a second draft. We find something which is missing. For MCQs, it is better to get a peer review or a self-review. A peer review, it depends on with whom you want to share your question bank. Then there is a self-review which can be usually done. Now, this is the way how peer review of MCQs is done in our situation, where we just see that the questions are clearly stated, the questions are free of errors, the distractors are feasible or homogeneous in nature, and the explanation is good and logical, and the answer is correct. This is one way of reviewing it, which is the subjective way of reviewing it. Then in the literature or the text, there are multiple ways of reviewing of MCQs which have been defined. There is classical test theory which reviews it on the basis of difficulty and discrimination. There is a difficulty index. There is a discrimination index. Now all these activities require statistical tools for their assessment or for the review, which is usually not the case in most of our institutes and our colleges. We do not have a question bank. We do not have a software which does this thing. So primarily we are left with either the peer review or the self-review on the basis of the knowledge which we have. And yes, but this is what has been described in medical education. Do it on the basis of discrimination index, difficulty index, and classical test theory. So now we come to the few examples of MCQs. Now, I will request the audience to just review rate these MCQs. Now, the first question is the example of genomic variation leading to adverse drug reaction is, so it could be sulfonylurea, it cause hypoglycemia, malignant hypertension syndrome, serotonin syndrome. So these are the few options. Then the other MCQ is preclinical safety studies in animals are used to evaluate or decide mechanisms of toxicity, all toxic endpoints as clinical trials, safe dose for humans, or chemical. The last option is the chemical profile of the test molecule. So it is open for the audience to assess the quality of these MCQs on the basis of whatever we have discussed. Then there is another example where we have given a case scenario of a patient, diabetic patient, who was prescribed glipizide, and 2 days later he presented with complaints of lightheadedness, sweating, and palpitations. Blood glucose level during that episode was 60 milligram per deciliter. Now, which is the best explanation in this case? Now, just focus on the term that it is the best explanation. So there could be other possibilities also. Among the options is the patient suffers from a cardiac issue, the patient is suffering from uncontrolled hyperglycemia, the patient is suffering from an episode of hypoglycemia, and the patient needs a neurological opinion. So if we look at the cardiac and neurological issues, we do not know how long the patient was diabetic. So it could be autonomic neuropathy or could be any other issues. So that is why the leading question contains the term, the best explanation for this case. Then how to design MCQ, there could be sample templates which can be used. There has to be a description of the patient with the history and findings and the medication which he is taking. This is specifically in context of pharmacology because we are having a discussion only on the drugs. Now, which of the following medication is most likely cause of it could be a history, which could be an ADR, it could be a finding on the physical examination, or it could be a lab finding. Let us say for diuretics, it could be hypokalemia. Then, which of the following medications, if you want to frame from the same case scenario, if you want to have another type of question about the mechanism of action, we can always add that which of the following medications work by the mechanism, or we can have a question about the drug-drug interaction from the same case scenario. So the first is the describing it in the patient description with history and findings and the medication which he or she is using, and then we can always frame questions accordingly. Now coming to the advantages of multiple choice questions. So advantage definitely is the scoring is easy and reliable. It is time efficient and it can cover wide breadths of topic than any other format. And well-constructed MCQs can also assess taxonomically higher order of cognitive processing like interpretation, synthesis, and application of knowledge. So these are the advantages. But what are the disadvantages? First major disadvantage is for the examiners who are going to frame the question is that it is time consuming to frame good MCQ. It takes at least half an hour to 45 minutes to frame one good quality MCQ in the first go. Then we need to review it, and following review, the time consumed is high. Then guessing works definitely. One of the studies has shown that most of the correct options are either B or C. So the student can easily score on the basis of guess. Then one disadvantage of MCQ is that only a part of the concept can be tested, unlike the textual component where we can always discuss the larger concept, and it cannot be exclusive component for assessment like we have discussed in the beginning. The way we assess the student it is going to drive the learning process, whether they are dependent on question bank or they are reading the textbook. And it cannot test all domains of learning, but like we have discussed, if it is framed properly, we can always test the higher domains of learning also. So that is all about my presentation, and I would be happy to answer any questions if you have.
Thank you so much, sir, for an elaborate talk on designing a multiple choice question. And what about item analysis, sir? How do you feel? What is the role of item analysis in the MCQ question?
Madam, item analysis is usually done through softwares. Like I've presented that whenever we are reviewing the multiple choice questions, usually we are dependent on the knowledge and what all we know from our the background information. Okay. If we have actual statistical tools for item analysis, we need to have a question bank. We need to give it to multiple students and multiple number of times. Then only we will be able to do a complete item analysis, which most of the times I feel that in our universities or our colleges, we may not have that software or that tool for actual item analysis.
Okay, another one question, sir. In CBME, we are having 20 MCQs in the MBBS. How many problem-based MCQs we can take in a question paper?
I will suggest that since we are going to test all the domains and analytical skills of the patient case-based.
Okay.
So that is a good thing, or the same case scenario can be used to answer the multiple questions. We can have at least the same case scenario and 5 different questions can be framed for the same case.
Okay, sir. And messages in the chat box is 2 messages are there. One is, what measure do you take, sir, to prevent whole collection of MCQ key in summative university theory examination in relation to MCQ? Will you kindly share your experience by Dr. Ranjit?
Just a minute, ma'am. Doctor, let me go through the question. Okay. What measure do you take to prevent a whole collection of MCQ? Okay. MCQ. Okay, what we do is we have a software. We have to conduct the MCQ examination through software, or it is basically computer-based examination where different key is prepared. So this is what we use. So this is one way of preventing that. Otherwise, different sets of the questions can be prepared, and I need to get the information about whole collection of MCQ. What exactly that means is that I am not able to grasp.
No
So
issue, sir. No
MCQ
issue. We have a WhatsApp group, and we can carry on further discussions on that also, sir. There is no problem.
Okay, fine.
Because we may find it difficult to answer, in detail. I understand of the hand. So we will, tackle these questions further. We got a detailed WhatsApp group. We can do that later on also. No problem.
Fine,
Thank you, sir. Thank you for an elaborate session. Thanks for giving me an opportunity. Thank you.
Thank you.
Thank you, madam. Thank you very much. And that brings us to the end of today's session. I thank both the speakers, both the esteemed speakers, Dr. Margret from CMC Vellore and Dr. Puneet Dhamija from AIMS Raipur. I also, from the bottom of my heart, thank both our esteemed moderators who have conducted this session in a very, very exemplary manner. And I'm sure that today's sessions, both the preparation of LAQ and SAQ and the MCQs have, done their bit to sensitize the members and the participants on how to prepare and what are the principles involved in preparing an LAQ and an SAQ and an MCQ. And at least the general principles, we have to stick to them. And let me also take this minute to inform everyone that we have got a dedicated WhatsApp group that we have prepared, and the links have been sent to all the participants in their registered email ID. And more than 315 participants have already joined that WhatsApp group. And that WhatsApp group is going to be active for the entire duration of the workshop for the next 1 month. And we will be able to have detailed discussions, any queries, any clarifications that are there, because all these speakers and all the resource personals are part of that WhatsApp group. So I request all the participants to join that WhatsApp group, and any query, any clarification that they may have can be posted there, and we will try our best to make sure that it is addressed. So with those words, I once again thank all the participants and everyone involved for this particular session. And we will meet for the next session in the next week. Thank you very much. And we'll see you again next week. Thank you.
Thank you all.
Ma'am, can we end the meeting? Dinesh sir?